Chaminade University's Doctor of Marriage and Family Therapy program is designed for clinically active professionals ready to practice at the highest levels. Today, we're meeting Yvonne Manupuna to learn more about the program.
I've been a licensed marriage and family therapist for about 9 years. When I think about the idea of healing, whether it's an individual issue or a whole family issue, I always think system. How do you get the whole system to heal? Marriage and family therapy was really that natural course into healing with the whole system involved, or as much as of the system as we can get involved. We aren't really taught how to deal with relational type issues, right? And interestingly enough, we come into this world in relationship. And because we're not taught how to sort of, whether it's traditional schooling or a lot of times role modeling, going through the course of something like family therapy or couples therapy helps to both provide normalization when we think about life cycle stages and how families evolve, and then also offers real practical ways for how to deal with some of these things that we go through in our life cycle stages. So whether you're thinking about getting married or being in a relationship, let's even go before that, to maybe having a full-on family. There are different stages of life cycle development, and doing family therapy helps us understand what those different stages are, and then learning coping skills, learning ways to manage in these tougher situations. Now more than ever, mental health issues are a thing, and we're realizing that it's more of a common thing that we've thought of before. I think more nowadays, folks are willing to get help, they're willing to get support. And therapy can be that avenue to do that. Having a neutral third party present oftentimes is helpful for couples and for families. My experience here with the Chaminade DMFT program has been wonderful. I think one of the great things is getting the support that I've been able to get here with the faculty. Dr. Hawkins, Dr. Kahumoko Fessler are both women who are actively practicing. They are passionate about what they're teaching, and they really want us to be quality clinicians. A lot of the thought process I had in going into the DMFT program was, how do I become a better clinician? How do I become a quality clinician for my community? And I think one of those ways is to continuing my path to education. And that's what originally drew me to the DMFT program. I've got a tight-knit cohort. A lot of my cohort members are folks serving our community here in Hawaii, and I've developed great collaborative relationships with them as well too. One of the benefits also too of the DMFT program is the opportunity to teach here at the university. We've been able to do that, participate in some presentations and research of our own in culturally adaptive care, so serving our community, people from Hawaii that live in Hawaii. I've seen the topic around family therapy certainly become more popular. I think social media has to do a lot with that. There's a normalizing too of seeking therapy, and so the interest certainly has expanded. I think post-COVID we saw a lot of sort of anxiety and depression, mostly amongst our adolescents. And so we know that quality care for adolescents is to include the whole family, and so that's been a bit of it as well too. For more information about Chaminade's DMFT program, visit chaminade.edu.